Good afternoon, this is Dr. Do again. It's good to see you. Alphabetically, we talked abdominal pain last time. I finished the what I can think, what kind of symptoms you need to go to the emergency, what kind of symptoms you can manage at home or call your physician. Today I'm going to move to another symptom, another problem. It's called aspiration. What is aspiration? Aspiration is the content of your stomach back up and you get into your lung, respiratory system. Depends on whether your stomach is empty or it's full. It could cause pneumonia or pneumonitis. For example, if your stomach is really not full, you know the stomach contains a lot of acid, hydrochloric acid. So when that acidic material, a liquid, reflux back and you enter into your lung, it's called chemical pneumonitis. And if you have a full stomach, your food get reflux get into your lung, so that will cause, because those are the good media culture for bacteria, so that could cause pneumonia. So this is basically, it could be very dangerous, could be life-threatening even. Depends on your physical condition, whether you have any pre-existing medical problem, and depends on the causes. Here are usually the causes of this aspiration. First of all, post-stroke patient. Okay, if you have family members or if yourself has previously stroke and you have still not fully recovered with swelling, or your muscle still weak on your facial muscle, or your oral or your larynx muscle still weak, so that is the risk for aspiration. The other one is if you long-term drinking alcohol. I do not like to use the term for alcoholist, but it's really referred to if you drink a lot of alcohol, you lost consciousness, just deep sleep, and your position is not appropriate. So then this might cause aspiration. Okay, and the third one is it could happen to the young people without any major medical problem, just obesity, have the reflux. So what the reflux is quite common, no matter whether you're young or you're old. Tend to occur in the people who are overweight, and especially you eat large meals before the bedtime. So I'm going to break down individually. Let's start from the reflux, because it is so common. It could happen in anybody. It's called gastro esophageal reflux disease. GERD, G-E-R-D is the short form. So this is basically your the junction between the esophagus and the stomach. There's a muscle, circular muscle structure to tighten. But in some people, this probably, especially if you're overweight, this muscle probably getting loose. So then the content of the stomach will reflux back to the esophagus, and also going back to your throat and through the opening to your respiratory system. So, excuse me, for the GERD, what kind of symptoms you might have? Usually it's heartburn, very common, or discomfort on the upper gastric area, not really pain. Sometimes you may have the pain if associated with the gastritis. Usually it's just heartburn, uncomfortable, and regurgitate. You can feel that. Tend to occur, like I said, in those either you're young or you're old. Actually, a lot of young people, when they have overweight, this tend to occur. So how to treat this? You can use TOPS. You can use the over-counter like omeprazole, or you can talk to your physician. They give you prescribed medication like Protonix or anything else to help you. I think in the long term, if you want to manage by yourself, start from losing weight and sleeping in the high pillow. Okay, so you raise your shoulder and head and neck up. So if you imagine, if you raise this position up, so the chance of reflux is low, decreased. And the other prevention measure is just the limit food intake before bedtime, or just keep eating small meals during daytime, not a large meal. And of course, the most important thing, the radical treatment is go to your physician, have a test, confirm you have it or not have it, and then give you treatment. Okay, so this is the best way to prevent aspiration, by prevent the regurgitation. Okay, so what kind of symptoms are you looking for? How do you know you have the aspiration, either pneumonia or pneumonitis? First of all, if you had history of stroke, or if you have family member had a history of stroke, you'll take care of that person. The fever, of course, or coughing, it's kind of could just dry cough, and like a heckling cough, that might be the aspiration. Or if you know someone or yourself drink alcohol, sleep very deeply, and next morning you woke up fever and coughing, not feeling well, or you can feel chest uncomfortable, chest pain, that could be the aspiration. For the GERD, like I said, the same thing, the same symptoms. Especially if you ate a large meal during weekend and then you slept right away, and then you woke up next morning, you feel bitterness in your mouth, and bitter taste, and dry, and hoarseness, and at the same time you feel coughing or fever. So that could be the aspiration. Sometimes it could be minor. Your body, since you're young, your body can clean it up. Okay, but it's like I said, if you have stroke, older patient, or if you have drink alcohol for a long time, this kind of people, it's hard to clear by itself. So if that's the case, you had coughing, fever, you contact your physician to make sure how to diagnose this. So if you call your physician, tell them, my mother or my father had a stroke, and he just recently developed a fever, coughing, and the physicians will bring you in, or you go to emergency room, they will check, have an x-ray, will tell whether you have aspiration or not, whether it's a pneumonitis or pneumonia, and they will diagnose it and then treat for you. The same thing if you drink alcohol, get drunk the previous night, and then couple days later, or next day or couple days later, you had the symptoms, and you call him, don't forget to tell them you just had a couple of days ago, or just yesterday or 2 days ago, I was very drunk and I fell asleep, and now I have the fever and coughing, and then that could be aspiration of pneumonia or pneumonitis. For the young people, like I said, for the people who had reflux, if it go away, then it is fine. But if a couple of days and a week still has the coughing, then you should call your physician and to check it out to make sure the lung is fine. So this is the another alphabetical list of the problem next to the abdominal pain called aspirational pneumonia or pneumonitis. So this is what I can think. If you have any concerns, or if you have any ideas or suggestions what we should discuss, I will be happy to hear from you. The next topic on this video, I'm going to mention about the advanced care. This is it's very important. It's not directly to related to your health, but I think it's very important. Sometimes it's not very well addressed. Many people of you have known, and you have lawyer, you have legal representative, or surrogate or proxy. that's fine. You can do that way. And if you don't have this kind of legal or team to work for you, then you can your will conveyed to your family. That count also. So there's if for those young people, I recommend you pay attention to your parents. They probably convey this message, communicate the will, in a subtle way. Not to say, hey, before, in case I'm dying, blah blah blah, like this. Probably just say, look at that patient, or I just read the history, or just read the story, who had the the end-stage disease and what kind of treatment he received. If that were me, I probably do this. This is the conveying the message your parents are trying to tell you what they want at the end of life, the end stage of the life. And for those parents, if we have adult children, I also recommend you do the same thing. Communicate with them in a subtle way. Just not suddenly say, "Hey, this is my will." They might be scared, but you just mention this either through the movie or through the people you know, just in a modest way to let them know, if in the case of the end of life, what kind of care you want. So this is the very important issue. And also you can convey to your doctor. That's the one I'm going to talk. Usually during the physical exam, no matter you're young or old, your physician might ask you at a certain time or point, what do you think about the what kind of care do you want in terms the end of life or stage for the healthy people? And you can tell the doctor, and along the way the doctor might brought up to you several times, and then you can change. It doesn't mean you have it, it's just settled there, but you can change, modify it along the way. And for those who had previously serious disease, for example, you had cancer, your doctor will definitely ask you what kind of care do you want toward the end of this management, or we work together to treat your cancer, but just in case you're not getting better, what going to do? What kind of will do you have? So this is the very important issue and the concerns, and it's good for everybody. For the physicians, they have idea what kind of care you want, and for you, you know what you want, and you convey your message to your physician. So in case something happened, everybody is clear about this. So this is the topic on this video. I hope it helps. If there's something information not accurate or not right, I will correct next time, and your feedback will be highly appreciated. Thank you so much for tuning in. We'll see you next time.